Governor Gina Raimondo has announced phase 2 of her road to reopening plan will begin on Monday. Good evening, I'm Shannon Heggie. This as the Department of Health announces another 122 new cases, positive cases that is, of COVID-19. Here's where things stand right now. 16 more people have now died of the disease, bringing Rhode Island's death toll to 693. The health department says hospitalizations are down to 219 people. 47 of them are in intensive care, with 33 people on ventilators. Eyewitness News politics editor Ted Nesi is at the State House with what else the governor had to say today about phase 2 and beyond. Ted?
Well, Shannon, Monday will be the first time many Rhode Islanders return to restaurants and gyms, but they're going to do so under quite different circumstances.
We're seeing good news.
Governor Gina Raimondo making it official, phase 2 of her reopening plan will definitely begin Monday. A decision tied to 4 key metrics.
These are the 4 measures, when taken together, not one, but when taken together, that tell us whether the virus is under control.
Among those, less than 30% of Rhode Island's hospital beds are currently filled, and the virus's rate of spread has slowed dramatically.
Why is that happening? Because you're wearing your masks. You are staying 6 feet away from people. You are staying home when you are sick. You are working from home.
But as this Target 12 map of official data shows, some parts of Rhode Island are still struggling to get COVID-19 under control.
We still have certain communities, Central Falls, Pawtucket, Woonsocket, areas of Providence, where our test positive rate is too high. We want to be below 10%. They're still at 20%.
Looking ahead, Raimondo hopes she can lift even more restrictions by moving to phase 3 around July 1st. As for after that,
do you expect we are in phase 3 then kind of indefinitely till there's a vaccine? Do you think you'll create a phase 4? I know we're talking about phase 2, but what are you thinking about after phase 3?
I don't know. Honestly, we need to figure that out when we get there. And it could be that there isn't a phase 4. It could be that these are the guidelines. Let's live our lives. It could be that we're in a place where we're just not there yet, and there is going to have to be a phase 4. So we are not today ready to say.
And the governor also confirming today that visits will start to be allowed at some group facilities, such as DCYF group homes, but they still won't be allowed during phase 2 at nursing homes. Coming up new in 5:30, the governor explains why that policy is staying in place for now. Live at the State House, Ted Nesi, Eyewitness News.
Eyewitness News politics editor Ted Nesi is at the State House with what Governor Raimondo had to say about visiting nursing homes and hospitals during phase 2. Ted?
Well, Shannon, one of the policies for this pandemic that's caused the most pain to families is the ban on visiting loved ones in nursing homes and similar facilities. Today, the governor said in phase 2 they will be relaxing restrictions on visits to some facilities such as DCYF group homes, and there will be virtual visits allowed at the state prison. But nursing home visits will still be banned.
The situation in our nursing homes is not stable yet where we need it to be. And Wyatt and ACI and a DCYF group home is different because the people who are in those facilities are not all high-risk populations. You know, the kids in a DCYF group home or even in Wyatt, not every inmate is in a high-risk category. Everyone who lives in a nursing home is a high-risk category. And I get up here every day and say, 20 more deaths, 20 more deaths, 700 deaths, and the majority of these people are in nursing homes. So it was a brutally difficult call. We just don't think it's safe. And the fact of the matter is, we've learned from experience, it's hard to enforce this stuff. So yeah, maybe you're right. Maybe we could have come up with a very limited visitation, which if it were perfectly followed would be safe. But we know that's not what happens. Because when you start it, the temptation is, well, I'll just sneak in, or I'll just go to the window, or I'll just stay a little bit longer, all because we love the people who are in the nursing home. Not because of that, but we just feel that the risk is too high because of the nature of the population and frankly, the workforce. We have to keep them safe.
The governor also said hospital visits are likely to be allowed in limited form during phase 2, primarily for family members whose loved ones are nearing death. She said that she expects individual hospitals to make and announce those decisions. Live at the State House, Ted Nisi, Eyewitness News.